Hello, hi, my name is Amy Sakina, and today I'll be sharing about the Sheridan Gardiner Test and Catford Drum, which are used in pediatric clinics for visual acuity measurement. So according to the Faculty of Ophthalmology's and Snellen Standard, the Sheridan Gardiner Test contains both near and distant vision tests and also reduced Snellen vision tests. As we all know, testing visual acuity in children can be difficult, mainly because they lack knowledge of the alphabet. Therefore, this test is suitable for children as this test depends on matching shapes rather than identifying or naming the letters. For your information, the Sheridan Gardiner Visual Acuity Test is suitable for children between the age of 2 to 7 years old. So, what can we get in the Sheridan Gardiner kit? In the Sheridan Gardiner kit, we can get an instruction manual, a transparent plate for the patient, or we call it the key chart, a distance chart that ranges from 660 to 66, a distance chart from 63 to 33, and also a near vision chart. In all this chart, it consists of 7 letters which are X, U, O, T, H, A, and V. Next, we move on to the procedure of Sheridan Gardiner. So how to perform the Sheridan Gardiner test? This test is quite similar, just like how we do the Snellen visual acuity test. However, before the acuity test is done, firstly give the patient the transparent plate, or we call it the key chart, which contains a selection of letters. Then, show random letters and ask the patient to point to the letters on the key chart that is the same as the one on the card that you are showing. This step is to make sure that the patient understands your instruction before you start the assessment. If you see that your patient understands your instruction, then you can start the assessment. Firstly, cover the left eye to test the right eye's visual acuity. For distance vision, the test may be carried out at 6 meter or at 3 meter from a mirror. Then, show the child the letter and ask them to point at the corresponding letter on the key chart that they are holding. Flip the distance card until the best acuity that the children can see. Start from 660 and to the best visual acuity. Record the patient's visual acuity for distance and repeat the same step on the other eye. After you examine the distant VA, continue the same method for near vision test at a distance of 40 cm using the near vision chart. So, using the Sheridan Gardiner Acuity Test has its own advantage and disadvantage. The advantage of this test are the reading test has print size from N5 to N48. Next, it is suitable for children 2 years old and above. Then, this test can also be used for deaf-mute or patients that are unable to interact. After that, the results using the Sheridan test are more reliable than illiterate e-tests. Lastly, the advantage of using this test is that the reading test includes reduced Snellen used at 33 cm. However, this test also contains disadvantage of its own, which are the letters vary in legibility, and there are limitations in the detection of defects including amblyopia. Next, we move on to the Catford Drum test. So what is Catford Drum test? The Catford Drum test is also one of the tests to detect patients' visual acuity. In this test, the children is made to observe an oscillation drum with black dot or stripe of varying sizes. The thinnest line that evokes the pendular eye movements denotes the level of the child's visual acuity. And this test is very useful for infants and preschool children, which is suitable for infants aged from 6 to 12 months, basically children below than 1 year old. So, how do we perform the Catford Drum test? Let me explain. So firstly, switch on the Catford Drum. At a distance of 30 cm in front of the patient, place the Catford Drum with the thickest stripe and start the device. Now observe the patient's eye movement. If you see that the patient's eye moves following the movement of the stripes, it indicates that the patient can see the stripe. Then gradually change the size of the stripe until no eye movement following the stripe is seen. Then record the visual acuity of the patients according to the smallest dark stripe that the patient sees. Simple, right? So now we came to the end of this video. Hope you learn a lot. Thank you for listening. Bye!